Are we ready? This is video B of vestibular function 1, and in this video we're going to be talking about angular acceleration. So angular acceleration means when you're turning in a circle. And so if you're spinning in a chair, this would be horizontal angular acceleration. We can have angular acceleration in three main directions, but of course there's variations between. It would just involve combinations of these semicircular ducts which are involved in this process. So we have yaw, which is rotation around a z-axis. And that's like if you're an ice skater and you're spinning around and around and around, you would be yawing, I guess. And then pitch is rotation around the y-axis, which basically goes between your ears. So if you're doing a somersault, for example, that would be a pitch, or nodding your head. And then roll is rotation around this x-axis, which goes from the nose out the back of your head. So if you're going like this, that would be that kind of a movement. And importantly, acceleration is a big part of this. So the semicircular ducts, the hair cells within them, are going to respond when you're accelerating. But if you're having a continued velocity, they're not going to detect that as much. So that's important to keep in mind. So we have three pairs of semicircular canals. So we have two semicircular ducts or canals that are horizontal. They're not actually horizontal. They're about 30 degrees. But this would be a horizontal semicircular duct, and that would be, there would be one on each side, and those pairs work together. For the anterior and posterior ones, it's a little more complicated. It turns out the anterior semicircular duct on one side is going to work with the posterior duct on the other side. So the ducts that are parallel to each other form a functional pair and work together. So this is back to our diagram we've already seen. Here's our semicircular ducts here. And you can see at the base of each is this patch of sensory epithelium that I already talked about. And so now what I'm going to do is I'm going to draw a diagram on the board and take you through how this works if we're getting acceleration of the head in a certain direction. So we're going to be talking about the horizontal semicircular canal just because it's the easiest to talk about, but it works the same way in the other ones. Okay, so we have a semicircular canal here. For reference, our utricle, which is not part of the semicircular canal, but that is, remember, an otolith organ. That is medial to the semicircular canal that I'm drawing. So that's there for orientation. This is the actual semicircular duct here. And so we have something that looks a little bit like this. And we have our hair cells that are going to be located on this boundary right here. And remember, they're connected by tight junctions. And we have some of them lined up. In the case of the horizontal semicircular duct, the tallest stereocilium, or the kinocilium, is going to be next to the utricle. Okay, so this is our tallest, or I'll just put the kinocilium. Kinocilium, closest to utricle. And then outside of here, this is going to be our bony labyrinth. And then this is going to be our membranous one. Duct is going to be that. So our membranous duct, as you have already learned, is going to contain endolymph. So we're going to have endolymph in here. And that's going to be the apical aspect of the hair cells that I've drawn. And then we're going to have perilymph in this area here. That's going to bathe those basolateral cell bodies. So this is going to be a perilymph. So it's the same concepts, just drawn in a little bit different way. So now what happens if we get a head rotation to the left? So if we have our head turning left, so that direction, or it's actually going to be, it's an angular acceleration, so it's going to be more like this, but it's turning, right, because it's an angular acceleration. What happens is that the bone moves that way as the head moves that way, but because this endolymph is a fluid, it's going to lag. And so it's not going to move as quickly as the head. So relative to that bony part moving, the endolymph is going to be moving in the opposite direction. So it's going to lag, which relative to the bony part, it's in the opposite direction. That's going to push these hair bundles towards the tallest stereocilium. That's going to result in depolarization of these hair cells in this left semicircular horizontal duct. That's going to result in an increase of glutamate. And that's going to end up in increased activity in the vestibular part of cranial nerve 8, the vestibular cochlear nerve. Now what you should do is, when you're at home, is draw the other side. So here would be the midline. On the other side, we would have a mirror image of this with the hair cells oriented this way again. So they would be facing the utricle. And if you work through this with a head turned to the left, what you'll find out is on the right side, the hair cells in that semicircular duct are going to end up hyperpolarizing because that hair bundle is going to be moved the other way. And if you work through that yourself, that's going to help you understand how this all works. So here we have a diagram of a semicircular duct showing a similar thing. So we have rotation of the head in one direction. There's going to be a relative endolymph motion in the other direction, which is going to be a lag of that fluid. That lag then is going to result on pushing the hair bundle and its associated gelatinous mass, which I should draw in there as well. So this is called a cupula, that gelatinous mass. So that's the cupula. That's the hair bundle is embedded in, and here we have it here. So that whole thing is going to be moved in one direction depending on the head movement and the lag of that fluid. That's going to result in moving that hair bundle one way or the other way. And then this shows just a different diagram showing our hair cells here. It's hard to see here. These are not axons on the hair cells. These are nerve fibers contacting those hair cells. Hair cells do not have axons. So this would be part of vestibular cochlear nerve. And then here we have our cupula, and this area in here would be filled with endolymph, and this area here would be bathed by perilymph. Because remember, potassium is our charge carrier that's going to result in depolarization of those hair cells. Now, I've said a couple times that these cells are going to detect acceleration, and this slide takes us through why. So if we get an initial head rotation to the left, that endolymph is going to lag and go in the opposite direction and move that cupula and the hair bundle in a specific direction. However, if you keep rotating in the same direction at the same angle, eventually that endolymph is going to catch up and be going at the same speed in the same direction. That's going to end up decreasing the movement of that hair bundle. It's going to be more straight up and down, back to baseline activity, and you're not going to get stimulation of the hair cells or the vestibulocochlear nerve. However, when you stop, now the head's going to stop suddenly, and that fluid's going to keep going for a little bit, again because of the lag or the inertia of that fluid, And now it's going to push the hair bundle in the opposite direction when it stops. So this system, you get an on response when you start or accelerate, and then you get an off response when you decelerate. And then again, after a certain amount of time, that's going to stop having an effect as the fluid matches the movement of the head. So, alcohol. So most of us know that if you drink too much alcohol, like a lot of alcohol, you can end up with what's called the spins, to where you lay down in bed and it feels like the room is going around and around. So what happens with that is that as that alcohol diffuses out of the capillaries, it goes into the cupula. And it makes the cupula less dense than the surrounding endolymph. And because it's less dense, it tries to float. So when you move, that cupula is trying to float relative to the other movement, stimulates that hair bundle, and makes you feel like you're moving in a circle or accelerating in angular acceleration. Now, whether or not this helps or not, I don't know. Maybe that makes all those semicircular ducts in a specific orientation. It's more likely that this movement with the alcohol is affecting his ability for the vestibular system, the visual system, and the proprioceptors to work together. So it's likely he's got a bit of nausea there, and that's why he's by the toilet. But that's alcohol, and that is the end for this video. In the next video, we're going to talk about linear acceleration.